Hello everyone. You are listening to this audiobook on channel Voice for Purpose by NSS IT Bombay.
There are various doctors in different parts of the world who contributed in the fight of coronavirus but lost their lives in the fight against this deadly virus. Here are some of the doctors of different countries who all had to give away their lives due to the state of corona in which we all are living. Dr. Li Wenliang, an ophthalmologist from China. The death that broke several hearts in the initial days of coronavirus spread was of Dr. Li Wenliang, a Chinese ophthalmologist, a specialist in the branch of medicine concerned with the study and treatment of disorders and diseases of the eye, who tried to warn fellow practitioners about the potential outbreak of a virus. Unfortunately, he was accused of making false claims and misleading the public. Dr. Li's warning did not depend on sophisticated laboratory testing or expensive imaging studies, but his own understanding of biological plausibility, the kind of analysis that clinicians of all specialties could make. The New York Times reported that on January 10, 2020, Dr. Li developed a cough after having treated a woman for glaucoma who had unknowingly been affected with coronavirus, probably by her daughter. No report suggests that he observed any ophthalmologic complications of the corona infection in his patient. The 34-year-old eye specialist in his Weibo story revealed how he had come down with cough and fever after a month of his warning gone unnoticed. Dr. Li passed away on February 7, 2020, leaving the people in China and worldwide grieving and angry. Another doctor who died of the disease in Wuhan was just 29 years old. As per the reports, he had postponed his Lunar New Year marriage to serve humanity and treat patients who had been hit by the virus. Unfortunately, he ended up contracting the virus from one of his patients and died a hero. Dr. Robert Stella from Italy. Dr. Roberto Stella, aged 67, was an Italian general practitioner who died on March 10 at the Como Hospital as confirmed by the town's mayor, Mario Lanscrena. He died of respiratory failure due to coronavirus. Like other heroes, Dr. Stella had contracted the virus while actively taking care of patients and guiding them on proper care. Another case that shattered millions of hearts across the world was of a nurse who had reportedly taken her own life after being tested positive out of fear of spreading the disease to others. A 67-year-old physician in Italy who, despite running out of his protective gear, continued to treat the patients, ended up sacrificing his life. Furthermore, a 34-year-old doctor, Daniela Trezzi, who had been working on the front line at a hospital in Lombardy, died after catching the disease. Her death was confirmed by the National Federation of Nurses of Italy. Dr. Jean-Jacques from France. Jean-Jacques Razafin-Andranzy was the first French doctor who died while treating coronavirus patients. The 68-year-old accident and emergency department doctor was retired, but the passion that he had for serving humanity was undying. Thus, he volunteered to help his colleagues save the lives of people, as the number of increasing patients continued to increase. The retired doctor was working in an emergency ward at the Lille University Hospital where he caught the disease. His death was announced through a social media post titled, "My Father, a Hero," written by his family. Dr. Usama Riaz from Pakistan. Dr. Usama Riaz, a young 26-year-old, became the first Pakistani doctor to die of coronavirus. He remained on the forefront screening people returning from abroad from the Pakistan-Iran border at a hospital in Gilgit-Baltistan. He was busy fighting the deadly virus with utmost bravery and confidence when he contracted the virus. Upon showing symptoms, he was rushed to the hospital and was put on a ventilator, but he could not make it. He proved to be a real hero by sacrificing his life while saving the lives of many. Dr. Adil Iltayar from UK. 63-year-old Dr. Adil Iltayar became the first frontline health worker to die of coronavirus in the UK on March 25. The organ transplant consultant was performing his duty at St. Mary's and St. George's Hospital in London, where he contracted the virus. He started showing symptoms in mid-March, due to which he immediately self-isolated himself. In a matter of 12 days, he went from a perfectly fit doctor treating patients to a COVID-19 victim lying in a hospital morgue. Dr. Shireen Rouhani from Iran. The Iranian doctor Shireen Rouhani also lost her life while treating coronavirus patients. Her determination and willpower was such that she continued to treat patients till her last breath, even when she herself was on IV. She knew she could not rest because of the shortage of doctors and medical workers to cater to the needs of patients. Dr. Israel Baktol from Philippines. The Philippine Heart Center announced the death of first doctor, Dr. Israel Baktol, who was a senior adult cardiology fellow in training. The medical professionals in the country are devastated, and so are the citizens. While grieving the death, they have strengthened their resolve to make it the first and last death. While the deadly virus has brought attention to inadequacies in the healthcare centers across the globe, doctors and healthcare workers who have been risking their lives to save all of us. They are also risking the lives of their family members, which indeed is a huge sacrifice. On top of that, the shortage of face masks, shields, and protective gear is not helping. And this makes the efforts of the medical workers even more extraordinary. The sacrifice of doctors and healthcare workers across the globe will not go to waste. Humanity will always be grateful to them for what they are doing during these unprecedented times. The respect for healthcare professionals has grown manifolds in the hearts of the people. It is good to see that the Government of India, along with the governments worldwide, have decided to allocate more budget for healthcare in their respective countries. The world is taking the healthcare professionals and hospitals more seriously as it appears. More work is expected to be done for hospitals and intensive care units to strengthen the healthcare infrastructure in India as well as in countries across the world.
So hope you guys had fun. Please like, share and subscribe to this channel for more interesting audiobooks.